this introduction. And thank you for everyone being here. I am very grateful that you are here. And as a health promoter and as an instructor, I love activities and presentations to be interactive. So ahead, I want to thank you. If you have reactions or comments, to please post them in the chat. I am also reading the chat so I can, and vice versa, react to what I am saying, and I want to respect your experience says in these activities. So today's subject is very relevant to what you have been doing, and I hope that with this acknowledgement, you can go to the community and inform them about this subject matter. The title again is the vector-borne diseases and their impact in farm worker communities. The learning objectives today are 3. We are going to be very direct, but we're going to describe the top vector-borne. We try to do it simply, but to describe the main diseases in the US and how they are transmitted. The main ones that are vector-borne faced by outdoor workers, and explain this risk of vector-borne diseases faced by outdoor workers. And the third one is naming the key strategies to promote disease prevention among outdoor workers. I want to reiterate, these are 3 learning objectives, and I am hoping that at the end we can evaluate as to how we were able to reach or not these objectives today. So let's start. Speaking about vector-borne diseases in the United States, I want to let you know that this is going to be the emphasis of our chat today or training, knowing that this is also a global subject, but we're going to focus today in the vector-borne diseases in the United States for the farm workers or outdoor workers. So if you have comments or anecdotes or stories that you would like to share, please use the chat so we can post them. And also if you want to do it to expand in any subject, you can do it through the chat. But I also want to be minding the chat so we can add to our presentation. Well, the overview or the general description is a title of general description or overview. I was a little confused at first when I heard this, but this general description is mosquitoes or ticks or fleas that spread germs or pathogens that are called vectors. These are called vectors. So a person who gets bitten by a vector and gets sick has a vector-borne disease, therefore. Worldwide, about 17% of infectious diseases are vector-borne, caused by these vectors. So the example of the West Nile virus and Lyme disease are 2 of the most common vector-borne diseases in the United States. In other countries, it could be dengue or others, but here in the United States is the West Nile virus and Lyme disease, the most common. So we will speak about these in more detail a little later. But as I am mentioning about vectors, it is about the West Nile virus and Lyme disease or mosquitoes, ticks, and fleas. These are examples of some of these vector-borne diseases by type of pathogen. Again, the West Nile virus through mosquitoes. Dengue as well is transferred by mosquitoes, and also the bacteria and germs are transferred, like Lyme disease, by ticks, Rocky Mountains spotted fever by ticks, transferred by ticks as well, and via bacteria and germs through the ticks. So now let's speak about the trends in bacterial vector-borne diseases within the United States. These are graphs that show that since the middle of the 1990s, in the left part of your screen, the cases of Lyme disease between 1996 and 2019 have increased. Now, there are a lot of commentaries that can see these, that they are growing the rate of disease, but also there are times that is being diagnosed or observe a lot more. So it could be a combination of both, but it is very important that this is a disease that it is showing more, appearing more, and also with climate related subjects. And it is super important that we recognize the tendencies of these diseases. And the ones that have to be declared obligatory in a obligatory manner. These are diseases that have to be notified of to federal agencies so we can have a control or a general idea as to what are the tendencies. And as you can see, these tendencies have been going to a higher realm. And also not only the disease, but the reported cases at the national level within the United States. So farm workers, which we are going to speak within this panorama, so we can know which are the diseases that these vectors are being transferred to and affect the most to farm workers. Speaking about farm workers and demographics, we want to talk about the context. We are talking about an estimated 2.5 million, and this includes crop and livestock workers. The majority of crop workers are from Mexico, speak Spanish, but it is a very diverse community. There are a lot of dialects and originary tongues, and we have to take these into account, like the Creole and other dialects that are not Spanish speaking, but are important for us to recognize within this community. About half of them do not have work in agriculture annually within the United States. Almost half do not have work or residency authorization, but they still contribute to this activity. About again 13% migrate for work in agriculture annually. They do not have a certain place that they establish themselves, but they have to be traveling within the United States. 26% live in overcrowded housing within a hacienda or residence that is provided by a landlord or their employer. 71% earn an income of less than $30,000 per year. It is a population that works a lot, but is not paid or given according to the work they do. 52% of them do not have health insurance, which is a great problem and a great barrier for this population to have the good life living places and health reach of that. Poverty wages often equate to poor housing conditions, reduced access to healthcare, and longer work hours. So they usually have less access to medical attention, and in general, they work longer work hours, as we have mentioned. So you can see how this can be a challenge and a barrier, and that can cause greater conflict and lack of opportunities for this population. They also have greater exposure within the workplace. Insects are outdoor in livestock and wildlife. Temperature that can be extreme, and other threats that can increase the risk of exposure and make workers more susceptible to severe disease. Therefore, to these diseases, lack of education on top of everything, and or different type of education, better said, and the access to repellents of insect repellents is lesser, and the risk of mosquito and tick bites increases. Therefore, so sometimes they do not have the adequate access to information to know about this risk, and also the supplements or equipment necessary to be able to protect themselves. So these are all conditions that increase the risk, and that is why it is important that persons that are participating in this kind of activity, the workplace outdoors, and the community health workers can transfer this information for prevention as well and protection. The other key vulnerabilities, is the exclusion from safety nets, discrimination. Many of these employees do not have labor benefits, lack of job benefits, and at the federal level, the response has been very poor about immigration policy, also language barriers, and many of these materials and training are done in English, by example, and this can cause isolation to these populations that speak Spanish and other dialects. So this is why we had the option to do it in English and Spanish, but it is very important to us to be able to have a way to diminish these barriers. And also transportation can lead to indirect and systematic exclusion from safety nets and reporting systems. So these are other barriers and problems to do with access. Uh, Also, speaking about challenges, I had mentioned prior to these that farm workers and other outdoor workers may be missing in our public health system because of various factors. They're excluded from Medicaid and state-funded programs. They have lack of employer-provided insurance, so they are ignored or excluded. We can have concerns about immigration, or they rather have concerns about immigration status and being reported to any authority. They are afraid about raising their voice, or they are afraid that they will be made to register their immigration status, including myself. I needed help at a point in time about this, and I was very afraid about being asked my status, my immigration status, because I didn't know how they were gonna use this information, and I could possibly lose my job. So I reiterate that this is a big challenge to access services when it's lack of language access services or knowledge of common barriers by providers of and public health officials, like long work hours. These are barriers, very common barriers that we need to bridge, and also to educate them, and for the community health workers to bridge. Again, the linguistic access is a big challenge as well for these populations. In about strategies, the best way to reach these farm workers are best reached through local agencies, because they have established this trust, and they have access to these contexts at the local level, and they are the ones that have forged good relationships with these communities, like you, community health workers. So these local organizations that know the people and their background and have forged trustworthy relationships with them. And I want to repeat again the language access that needs to be built into each node of the system for people that not for the people to only speak many languages, but to have access to different use of different tools for these languages and these dialects, from setting appointments to contact tracing. And in the end, I mean, it's very important to destigmatize disease and reducing fears about immigration status. I understand that this can cause a lot of fear amongst this population, but it is important to be able to advocate with this population and to tell them that they too have the right to receive dignity in their health care, and also that is very important preventive treatment and access, regular access to a doctor or a health agency to prevent disease, and not to wait until the population is very sick to reach these um, subjects. So it is very important that we can talk about these challenges and strategize to help these vulnerable population. We're going to speak in more directly about the diseases. This is a tick that many times can transfer these Rocky Mountain spotted fever because these mountains are, it is in a certain portion of the United States, and that's where they were found, and this is why they derived this name. This is a disease, a tick-borne disease that is spread by ticks and by the bite of an infected insect or a tick, and many times through ticks that are in dogs and also within the wood. So these by the American dog tick, brown dog tick, and Rocky Mountain wood tick. It is very, very more deadly if antibiotics, doxycycline, are not given in the first 5 days. And many times in clinics, they say just call it doxy, but just so you can know that this is the antibiotic that if someone has contracted this disease, it has to be given within the first 5 days in order to avoid further problems. Half of all the deaths occur within the first 8 days of the illness. So you can imagine that a bite can be deadly. And if this can progress, this illness allowed to progress after transmission. So the highest incident happens in states along the US-Mexico border and found in urban environments. So people that are traveling from northern Mexico and those in contact with free-roaming dogs are at increased risk, or that are in risk in their travels. We have to pay attention, and we have to let them know to be paying attention about the ticks and dogs that can transmit through these ticks the disease. The early signs and symptoms can be fever, headache, rash, nausea or vomiting, stomach pain, muscle pain, lack of appetite can appear because people not feeling well. And early signs and symptoms are not specific to the illness, but these can progress rapidly and become something very deadly that can even kill somebody. So if a person becomes ill after being bitten by a tick, in the woods or high brush where many of these ticks exist, these fever of the Rocky Mountain can be present in New Mexico and in other places in the northern part of Mexico, and they must see a health provider. So we must pay attention to these early signs and symptoms in order to prevent a deadly outcome. So the official medication is doxycycline. It is very accessible, and it is recommended that is applied in children of all ages, including under 8 years old and pregnant women. And it is good to initiate as soon as possible if the person has been diagnosed a patient. Early treatment with doxycycline can prevent death and severe illness. So it is of most importance to be paying attention about these symptoms, and also not only of the symptoms, but as a preventive measure of ticks and their prevalence, and to be able to prevent. Now we're going to talk about Lyme disease. This disease is mostly transferred through vector-borne disease in the United States, and is one of the most common in the United States. Is transmitted by black-legged ticks, a different kind of tick, and there is approximately 500,000 people diagnosed and treated in the United States annually from this disease. So it is very important. It is a great amount of people, and this disease is the most common transmitted by vector. This disease is multi-system or systemic illness. It's a difference between a localized illness with a cutaneous uh, way, and it is a uh, in the early stages, about 30 to 30 days, there is a rash, flu-like symptoms, is localized, so very similar to flu. And also we have the later disease many months after tick bite, and it can cause heart problems, facial paralysis, meningitis, arthritis. So this is like later onset. So this even more complex and hard to treat. These two can be treated with a short course of 2 to 4 weeks of antibiotics. So approximately 1 month in order to be able to treat the short course of the disease. So allow me for one moment. Here we are. The areas where Lyme disease occurs, it is a little different from the one before, but these are the places that are of high incidence in yellow. States like Wisconsin, Minnesota, and places where there is a lot of water, and the northeast coast, a lot of woods, and other states that are similar, like Michigan, Illinois, Ohio, in where there the west coast, like California, Washington, Oregon, where there is also a good amount of transmission of this Lyme disease. It is very important in our conclusions or key takeaways is that they consider the tick-borne diseases during peak tick season is May through August, but in any febrile patient or patients with high temperature, we have to be paying attention mostly through May and August, but it can be any time of the year that these disease or bacterial diseases can be transferred, but they can be treated effectively with antibiotics. So it's early diagnosis and proper antibiotic treatment is of great importance and can help prevent more severe disease. So preventing tick bites by using effective bug repellent, and all of these before it can become a more complex and hard to treat disease. So we must prevent tick bites by using effective bug repellent in order to be preventive about these bites. It's also very important to do this in places of greater contact or in woods to be paying attention to, in order to remove attached ticks as soon as possible and be able to prevent the onset of disease. These are tick bite prevention advice. We can use EPA registered insect repellents, which is the federal agency that regulates these repellents, Environmental Protection Agency. It is very important that if we live in these states and there are a lot of ticks where we live, to perform daily tick checks. We giving this information to our patients. They need to bathe within 2 hours after coming indoors to assure that we haven't introduced these ticks to our living area. Also, it is very important if we can and we have access to a dryer to put the clothes in a dryer on high heat after coming indoors to kill these ticks through high temperature. It is important, if it is possible, to avoid tick habitat or areas where these ticks are predominant, and to prevent tick bites in pets, because pets are big source of transmission. They carry these ticks, and reduce tick habitat through yard management. So this is a very specific training, and this is a diagram that shows how we can eliminate or remove these ticks. If we see that we have a tick that has introduced itself in our skin, that it has bitten us, it is important to use tweezers, fine tip tweezers, to grasp the tick as close as possible to the skin surface, and to be able to make contact with this tick, to be able to pull upward with steady, even pressure, and do not twist or jerk the tip, because sometimes we do it with the tip, with the fine tip tweezers, and then we twist or jerk it, and that's not what we should do. We need to do it straight, pulling upward and steady, in a steady, even pressure manner. The most intact as we can remove it in a stable way. Once we do this, it is very important to, after removing the tick completely, thoroughly clean the bite area in your hands with rubbing alcohol or and soap and water, or at least one or the other, alcohol or soap and water. Uh, Again, these are resources that this organization, NCFH, has come up with about preventive tick bite prevention and Lyme disease. You can take this QR code in order to be able to reach more information resources of information, to continue to find information on tick bite prevention and Lyme disease in partnership with the CDC, or the Center for the Control of Diseases. And this way you can reach more information and share it with your patients or the person from the community that you have access to. Prophylaxis, it is very important as a measure. It is a way to prevent disease. In general, the CDC, the Federal Agency of Control of Diseases, does not recommend antibiotics after tick bites to prevent tick-borne diseases in general. It is not a recommendation. It is a general recommendation, but however, doing this prophylaxis of preventive treatment, it can be appropriate after, especially after a tick bite, and in areas where it is very common, and if the tick was engorged with blood, not flat, and if it was a black-legged tick. If it is engorged with blood or fattened, it is problematic. And also if it is a tick with black legs. These would be good reasons to begin as a preventative measure or prophylaxis these treatment with antibiotics. So here we show the doxycycline and in what dosages they need to be given for an adult, 200 milligrams orally, and it would be a one-time dosage. And for a child that weighs less than 45 kilograms or 99 pounds, it would be 4.4 milligrams orally, and the maximum or dosage would be 200 milligrams, but once. Again, this would be a preventive measure or treatment, especially in a place where it happens a lot, if it's a lot of cases recorded in this area, or if it is an engorged with blood tick or is a black-legged tick. One moment. Very well. Another thing that is important with this preventive treatment, with this Lyme disease, is that people who are bitten by a tick in areas where Lyme disease is common should ask their healthcare provider if antibiotics after a tick bite are appropriate. So always go by our clinic, our practitioner. We have to have in mind the kind of community and the amount of disease in the general area, and always asking for a healthcare provider if they advise antibiotics as a treatment. So now we are going to speak about a different vector, which is the West Nile virus. It has been paid a lot of attention in the last few years, and it is maintained in enzootic cycle between birds and mosquitoes culex. It is the type of mosquitoes that have been detected in 1999 in the United States, which is the most common cause of domestically acquired arboviral disease. The symptoms include fever, headache, body aches, vomiting, diarrhea, and or rash. And most people infected do not show symptoms. About 1 in 150 symptomatic persons develop serious, sometimes fatal illness. And no treatment for West Nile virus it exists. So it is of most importance that prevention occurs, that it is key within this vector-borne disease. About in terms of epidemiology in the West Nile virus, it is nationally notifiable. Of course, it is not reported the individual person, but also as a case, yes, as a case for control and acknowledgement of data. It is important that it is worldwide distribution and endemic throughout the United States, reported as to know where is occurring. And the highest incidence has happened in north central states. It's important to know, and that the illness onset is between May and December. The peak, July and October, as to the months that this is most reported and the greater incidence within the United States. The West Nile virus, human disease, the cases were reported by state of residence. And as you can see, were occurring in Maine in the northeast, the very tip of the northeast part of the country. And but you can see that in the whole country have been cases reported, and that's the reason why they have to be reported in order to have a system of acknowledgement as to where it is happening. The clinical features of the West Nile virus disease are 7 to 80% of infections subclinical or asymptomatic. The incubation period typically lasts between 2 and 6 days, but it can range from 2 and 14 days. The common symptoms are fever, headache, weakness, lack of energy, myalgia, or arthralgia, which is like chest pain, as we mentioned before, and the half of them are neuroinvasive, less than 1%, like meningitis, encephalitis, or acute flaccid paralysis, more serious illnesses, but these can be caused through this nature of neurologic, neuroinvasive, so could be even result in this. 10% of these neuroinvasive cases can become fatal. And the survivors can have neurologic sequels, headaches, cognitive and neurologic deficits if they survive. So again, headaches, cognitive and neurological deficits, they forget things, they have amnesia, for instance, and many other types of neurological problems like motor movement, problems of movement, etc. So it is why it's so important to be able to avoid these mosquito-borne diseases. And also the prevention tips are important because a single mosquito can cause a lot of trouble. So the best way to prevent West Nile is to protect yourself from mosquito bite using insect repellent, wearing long sleeve shirts and pants. I live in Texas, and this is something we have to do constantly. Wear long sleeve shirts and pants, although it is the heat index is high, but it is important that using long sleeve shirts and pants can avoid some mosquito bites. Also, if we're going to spend a lot of time outdoors, to treat the clothing and gear for prevention and to take steps to control mosquitoes indoors and outdoors in places that have water accumulation, not running water, is where they can grow and therefore bite us. So right now, I would like to open this moment for chatting in the chat to be able to find out if anyone that is participating has had an experience with this illness or if it's something that you are hearing for the first time. Thank you so much. So I'm opening the platform for your comments.